All right, so I am here right now today with Christine Leakos, and I have known and been working with Christine for more than 5 years in a number of capacities. And she's going to be a really great guest, not just today, but in the future, because she's got a huge point of view and experience in a lot of things that have to do with healthy living. So, Christine, why don't you introduce yourself and tell us a little bit about Christine?
Well, hello, and thank you for having me here today, Joe.
It's my pleasure.
I appreciate you on multiple angles,
Well, likewise.
from 5 years ago beyond. I first started with a few products to now me carrying most of them.
I remember you. I've broken a bunch of rules in my life with you. And one of them was when we first met, and you had called up because you were getting products from a rep that was not doing what they were supposed to do. And you were calling to like try to figure it out. And typically, especially at the time, I didn't deal with any of that, but I listened to you and I was like, well, all right, well, let's figure it out and open up that door. And then I can remember from that point forward for about the next year, I get these long phone calls and he would have all these questions. And you could, can I bother you for a few minutes? And 45 minutes later, we'd get off the phone. So, and somehow through it all, you've gone down a bunch of different roads that have taken you to where you are today. So I wanted to throw that in. You're going to get to do most of the talking in this conversation, but I just wanted to a point of reference that Christine and I go back a little ways, and sometimes the message that I have in this, breaking your own rules isn't always a bad thing. I think more often than not, having rules and keeping them does you more good than harm. But every once in a while, just following your gut and doing that thing that isn't part of your plan, but something says go ahead. Sometimes that's a good idea too.
Well, yeah, I've come a long way. I've come a long way. I started working for the feds. I worked for the federal government for over 10 years, but I always had this knack for a better well-being.
Uh-huh.
Since I was a little girl, I always watched what I ate. And I always wanted to know the meaning behind illnesses and diseases and how to really get down to the base of getting better.
Mm-hmm.
And everybody tends to gear more towards Western. And I'm saying, well, that's just a Band-Aid over the problem. Let's dive in deeper. So from Zumba instructor to professional to personal trainer, to then coaching people unofficially and officially, to then meeting you. And then, you go from one side, which is the government, and then you go into the cannabis industry, right? And CBD all included, whether it's THC or not,
right,
it's still cannabis.
The government still will get in your way if it gets any chance to do so.
Yeah. So naturally, I had a ton of questions. How do you advertise? How do you not advertise? What do you say? What don't you say? What key words will trigger the federal government investigation and things of that nature. So right. I've learned quite a bit, and you've been a great contributor to my knowledge, which I am eternally grateful. And here I am, push comes to shove. Now I'm going for my doctorate in ancient Chinese medicine.
Nice.
And the one thing I have not told you that I will be starting is that I know I went through the Liz McDuffie certification of cannabis and what, but I want more. More scientific driven cannabis knowledge. So I not only am going for the certification, but the final end product, along with and believe me, I know what it's like to be busy. So along with the doctorate, by the same time, I will have my second master's in medical cannabis.
Nice.
So at a higher level, speaking the science lingo at the medical level, instructing doctors on how to incorporate the medical cannabis with the allopathic medication.
Nice.
So that the patient doesn't fall short of getting better.
Yeah, it
Right?
seems like the answer isn't this or that. You know, both sides always seem to, the hardcore cannabis people are like, cannabis will do everything. Okay.
Mm-mm.
Well, it'll do a lot of things, but there's sometimes when I want an aspirin too, or whatever. It doesn't matter, and I think that this conversation a lot of times keeps coming back to well, let's find out what is the best thing for this situation here today. And why would you not have a tool in your toolbox? Like, why would you say, I don't want those metric wrenches because I won't need them?
Mhm.
What if you do?
Mhm.
And what if some Western solution is a good one? There's a time when even surgery is a good idea. Most of the time not, I don't think, but occasionally there's a time when, what do you do when your appendix breaks? Like, there isn't a natural medicine solution for that. You got to take that thing out.
You got to give science or Western medicine credit where it's due.
Exactly.
And emergency care is where Western thrives, in my opinion, my humble opinion. Now, we have to go back to basics.
Right.
And what does that entail? Holistic remedies, holistic treatments. And it's not one thing that's going to work. It's a well-rounded amount of things that may work, whether it's Chinese medicine, regular herbs, along the side of CBD. So I think incorporating all of it is going to be the benefit of the general public that's hurting out there. We have a lot of people that are hurting there. We have people with severe anxiety. We have people that have chronic pain. And I'm at the point where, not that I'm a master of anything, because I'm not a master of anything, but I am a major of a lot.
Yeah.
And what I'm doing is I'm taking what you've taught me, what my grandmother has taught me, what my mother has taught me, and 53 years of wisdom, along with what I continue to learn, is what I have to offer to the general public.
What do you think about this idea? Like, in my opinion, medicine is too often reactive and not often enough proactive. So, for example, when do you go see a doctor? When you're sick. When do you go to the emergency room? When you broke a bone. When do you go see the psychiatrist? When you have a meltdown, right? These are all whatever, and I could go on and on forever. But what if some of those things were somewhat preventable? And what if you focused on being healthy instead of treating your disease? And I know, like, all right, so for you who are listening right now, I an hour and a half ago went through this amazing healing regimen that she performed, and I'm not going to talk about all the details of it. I'll let you talk about what you see fit, but all these different elements brought into this treatment, and most of those, a couple of them were reactive to a condition that I was dealing with, some pain and some lung issues, but some of it I think had as much or more of a proactive solution. You think about things like, here's the thing that always gets me: why does the drunk guy never get hurt in the accident? Because he's relaxed and he's all flopping around, and the car hits and he goes blue, and then the guy that isn't so drunk braces and goes, and his whole body gets crushed. Well, what if we were all a little more relaxed in whatever way it is? Relaxed meaning not stressed. Stressed is the opposite of relaxed, right? So we all go through life with this stress that makes us rigid and stiff, and then we get hit with something and then we break. What if some of these things that you were working on, and massage being a part of, I think, a lot of modalities, is geared around causing you to relax, maybe to let your body do what it could normally do, or maybe to keep you from breaking in the future. I don't know, but
preventative care is key. Okay, well, diet plays
huge.
a huge contributing factor.
Right.
Also, what self-care measures are you taking for yourself? That is so important, because if you can't take care of yourself, what makes you the person willing to take care of someone? Can you spiritually, can you take on someone else's burden to make them better? If your foundation is a little, or spiritual foundation, you're not rock solid, you're not grounded.
Right.
You
can't pour out of a half empty glass.
Right.
You run out.
That's right. That's right. That's right. So CBD is a preventative measure that you can take. Why? Reduces inflammation. Reducing inflammation kind of closes out that door of illnesses creeping in.
Yeah, it's interesting. A lot of the people that come on as guests here bring up CBD, and it's kind of interesting because in some way there's a saturation point. Everybody's done hearing about CBD, but the point is, if there was a compound that was relatively safe, meaning it didn't have a toxic dose, and could do nothing more than just reduce inflammation without negative side effects, unless you take huge doses, and then you could get some whatever discomfort, but not a toxic dose. Wouldn't you think that would be a worthy element in anybody's toolkit?
Of course.
So it's funny how, you know, the popular culture side of this, where, you know, first everybody was afraid of it, then everybody loved it, and now everybody's sick of it. But the truth is, I think give it another couple of years, it's going to become a mainstay. Once the government decides that it's not so scary, it should be. I believe it's going to become a mainstay in a lot of people's toolkit, and it belongs there. It belongs in the doctor's toolkit. It belongs in the massage therapist toolkit. It belongs in the acupuncturist toolkit. It belongs in everybody's toolkit. What other kind of compounds, like you work with different herbs, Chinese herbs and Ayurvedic herbs, and even Western herbs. You were using mugwort. That's a classic European herb that goes back to, you know, Celtic traditions way back when, for all kinds of different things. What are some of your pet herbs that you think are just really the stuff?
Well, Artemisia, which is a Latin word for mugwort. There's also Aye, which is pinyin Chinese for this herb, anti-malarial, anti-parasitic herb that is used to smoke. You usually smoke areas to increase your chi, vitality, energy, circulation, reduce inflammation, pain particularly. It's an anti-malarial drug. Some people say it's anti some cancers as well, or at least some studies indicate as such. That's one of the.
So Artemisia is one of your
Artemisia.
favorites.
Yeah, that's one of my favorites. Mugwort.
Yeah. It's also wormwood. It's Artemisia's got a huge family.
There's different families too.
Yeah, but they all have some of those properties. And in fact, you were talking about parasites. It was known as a dispeller of worms. That was one of the, people used to get worms a lot more than they get today because of not cooking food right and eating things that had lots of worms in them, and not the good worms, but the bad worms. And this was one of the solutions to that, was a good stiff mugwort tea or whatever they would do for you.
Well, when you go to sushi restaurants, there's a green leaf. I can't recall the name of it off the top of my head, but there's a green leaf, and you eat it with the sushi. And actually, if that fish is contaminated, you're not going to get sick.
Interesting.
And authentic Japanese restaurants are going to have it. Not every sushi,
not a fusion restaurant,
but that is an herb we actually use.
Yeah.
To ward off, parasites. We use a tremendous amount of formulas in clinic. California state requires 100 and somewhat amount of herbs, or I think it's the nationals. But we have to know a lot of formulas, but within the formulas, we have a lot of single herbs that make up these formulas.
Sure.
Now, beside the way we treat in Chinese medicine is very different than Western. You go to the doctor, you're not feeling good. What are your symptoms?
Right.
When you go see a Chinese doctor, they're feeling your pulse, looking at your tongue.
Right.
They're looking to see, they're looking to see if you have an exterior invasion, whether it's an exterior invasion that went in the body, or do you have something trapped in the body that was orchestrated in the body, right? There's two different types of healing, whether it's external, internal. Is it hot or cold? Okay. Is it yin and yang? Okay. There's also dampness within the body that most of us have. There's also dryness, like some people that have dry lung, constant cough. It's a dry cough. So you're going to have heat in the lung. You can have heat in the stomach. Heat in the stomach is constant pain in the stomach. You can have also bleeding in the stomach, which is an indicator of ulcerations. Now, we don't really treat, you're treating the ulcer.
Right.
No, we're treating whatever your body's kind of displaying. Do you have aversion to cold? Do you feel cold like within your bones when you go outside? Do you sweat while you sleep? Are you getting adequate amounts of sleep? Are you using the bathroom, and how often? Are you fully eliminating? Because if you're not, that's a condition. And these are the things that we see.
That's actually one of the biggest tells of your health that nobody wants to talk about, which I don't blame
What's your
them.
poop telling
Yeah,
you?
but that's actually really, as I gone down my journey of losing weight and doing fasting and changing the way I eat, that was one of the things that I noticed changed. And then you're listening to doctors talk about, your gut biome and the problems with the Western diet, or most of the global diet anywhere, because of foods being grown all over the world, and our gut takes like 4,000 years to catch up to a new food. And we've been eating new foods for like 50 years that are grown everywhere in the world, and our gut's going, I don't know what to do with any of this stuff. So it gets inflamed and has all these problems. And that's one of the tells is, how are you eliminating your waste?
That's very important. Your excretions will tell you a lot about your digestive tract. Now, we're looking at more conditions that are stomach and spleen related. When you're not absorbing the right nutrients, it's clearly identifiable on the tongue. And
I don't even know what the spleen does. I'm serious. Like, I have some general knowledge with a lot of the working body, but I never bothered to ask, what the heck does the spleen do?
It actually helps make the blood.
Okay.
Okay, so the heart.
I try to learn something new with every episode, and so this is
yeah. So the spleen makes your blood.
Okay.
So as you're eating,
so you want a healthy one.
Well, you want to chew your foods.
All right.
20, 25, 30, even like 40 chews before you swallow.
So don't eat like Joe.
So what does that do? Number one, we can't eat like ducks.
Yeah, I know, but I do.
And unfortunately, I was taken to an emergency endoscopy because I was choking on chicken.
Oh no.
And after 2 hours, they had to perform an emergency endoscopy because the food was just not going up or down.
Oh no.
And that taught me to chew my foods before. Now, you don't chew your foods. The body is overexerting itself trying to break down.
Right.
And as you get older, that mechanism slows down significantly. As you chew as much as you possibly can, now your stomach's going to smile more because it doesn't have to exert so much energy. Now,
it also does another thing. It makes you take longer to eat, and you get enough time to actually feel full, because people don't realize it takes you like 10, 15 minutes from the time that you choke your food down until you actually feel it.
Exactly.
And that's why I eat until I'm friggin' beached whale, and then I'm like, oh, I did it again.
It causes, your body to, if your body's digesting the food and you're full, you don't want to move.
No.
And it's like abdominal distension almost.
Yeah, it's all horrible. Yeah.
Feeling it.
Right.
We have herbs for that. herbs for that. And Juan Leon is actually one of them. I forget what it's in Western, but Juan Leon is like a yellow type of herb. It's a little on the bitter side. So
Okay.
it actually expels.
Do you work with bupleurum?
I would have to know the Chinese name.
I think that's the Chinese name.
Say it again.
Bupleurum.
Mm-mm.
It's I think they call it dragon's blood or something like that.
Oh, well, dragon's blood. Yeah, we do use dragon's blood.
I think that's bupleurum is the plant.
I have to look at the pinyin name.
I have
of it.
another acupuncturist that we've done some things with the bupleurum tincture that we've tweaked and gave it a little nano CBD, and he loves it. It's his
Wow.
It's his pet elixir.
No, that's amazing. That's amazing. And in summary, I just want to say that in Chinese medicine, we look at the overall presentation of the patient. Okay, do they have shen, meaning do they have a shine to their glow, or is it dull? Is the person looking a little yellow? Do they have possible jaundice? You look at the sclera, the eye, the white of the eye. You look at the attention. Is your patient doing this as they're talking to you, showing a mental disturbance type of situation?
Now, do you remember as a kid,
Mm.
you go to the doctor and they would go, the first thing they would do is they would take your temperature, and then the doctor would take a tongue depressor and he'd say ah, and he'd shove your tongue down, and he'd look down into your tonsils, and then he'd take the tongue depressor out and he would look at your tongue, and then he would take the little ear thing and he'd look up in your ears, and he would take your pulse. Maybe he would do your blood pressure. I don't remember about the blood pressure, but they used to actually, back in the olden days, they used to actually look at those sort of, I don't know, tells, if you would, of general health, and you'd be able to probably start to make some guesses, if you will, after that, because it's telling you something, right? I don't think they do that so much anymore, though.
Well, we look at a person's tongue to kind of get an idea of what.
And you don't want a big crack going down the middle of your tongue. I'm just saying, I got issues.
No, we all have issues. We all have issues. I have certain cracks in my mouth too, because I have a little bit of stomach dryness. Ginger is so good for your stomach.
And it tastes good too.
Ginger is just amazing. Turmeric, ginger, a little bit of black pepper, freshly squeezed with hot water. Good stuff, along with lemon.
Big fan.
Yeah.
What do you think about lemon juice in the morning, first thing you drink?
I think the water needs to be warm, like
Yeah.
more warm than hot,
Yeah.
but not too hot.
Yeah.
And you freshly squeeze the
Yeah.
lemon on top of it, and then you drink that.
Yeah. Some people claim that's like the cure-all for everything.
Well, here's the thing. I do believe it helps with fatty liver,
Okay.
and it helps detox the liver.
Mhm.
And by you doing that, you actually improve your eyesight, because the liver is affected. It is affiliated with the eyes.
Maybe I should do that more.
Okay,
I do it in fits and starts, but I should do it more.
So turmeric, ginger, all these things are going to help you boost up your immune system as well. Lemon also. Lemon is like the body's detergent. It's like a natural detergent. Yeah, I started with lemon. Then 2 weeks later, I added my freshly squeezed ginger. And then the following week, I incorporated fresh squeezed turmeric and just dash it off with a little bit of pepper. So it's about 1/3 the glass, or maybe 2/10 the glass, and then the rest is hot water.
Okay.
That's what I
That's
do.
your morning-
I do it about 5 times a week.
Okay.
You never want to overdo anything. Give
Yeah.
your body a break for 2 days.
Yeah, that's another thing. People think, herbs, I'm going to take me some herbs and this is a good thing, so I'm just going to take the hell out of it. And, sometimes there are herbs that are pretty safe and you could probably eat all you want. Like you could eat all the broccoli you want and never get sick from it. Like you could never,
That's not true.
well, you'd have a hard time. You'd have a hard time overdosing with broccoli just because it's so full of fiber and water that whatever might cause you grief, you'd have a hard time eating that much.
I have to limit my broccoli intake.
Oh, okay. Well,
Okay.
not me. I eat all I want.
Broccoli is amazing, high in iron. But I can't consume it too much because I get extremely gassy.
Yeah. Well,
Okay, so I have to really.
there is that.
Yeah.
It has side effects for most people, I think.
So I incorporate some asparagus,
Uh-huh.
maybe some squash,
Uh-huh.
Zucchini
Okay.
is great. Onions, you should be eating onions all the time.
I do.
Okay, because
I like onions.
onions fortify your lungs.
Yeah.
Also, another concoction because of I do this too. Whenever I get raspy, I take honey, watercress, radish, onions, garlic, ginger, crush it up really, really, really tiny. Lemon, a little bit of seasoned salt, leave it on the side. Keep it there for like a week, 2 weeks.
Probably keeps the vampires away too.
Take a teaspoon of that every day
Oh, yeah.
until all this stuff clears
Okay.
up. It's really
Just
amazing.
scare it the hell out of you.
Well, it's fortifies your lungs. It's
Right.
amazing.
Yeah, yeah.
This treatment has been used in my family for
Okay.
a while.
All right.
Yeah. Also, sheep fat is good.
Sheep fat to eat?
So rub on the chest.
Oh, okay. That's like lanolin.
Sheep fat because it's very warming.
Where do you get sheep fat?
You
Have to boil a sheep?
You just accumulate all of the fat and you move it. And then you add camphor and you add salt. Yeah, that's it.
All right. Interesting.
You can add some CBD to that too, but that actually, when you have bronchitis, and that actually warms your chest because you have colds in there trapped. That along with moxa and maybe some acupuncture points and definitely some herbs, Chinese herbs. But again, in Chinese medicine, you treat the condition. Like they don't take herbs just for kicks and giggles. Oh,
Right.
well, this is anti-aging.
Right.
What's a contraindication?
Right.
You have to know what the contraindications are. There's also, we took actually 3 classes, pharmacopoeia and combining Western meds with Chinese.
Mm-hmm.
Okay, what are the side effects that you have to look this stuff up.
Right. Well, that's just it too, is like, I read articles a lot because there's good information. You gotta be cautious with that because you get good information with crap mixed together in a reasonably tasting soup, and you eat the crap sometimes because it's mixed in with the good stuff and you don't know what's what. So I tend to, when I say, okay, I'm going to repeat this as though I believe it, I'll see a study that comes from, the National Institute of Health or something that's got science behind it. There were some researchers that put a study and here's what they got. But grapefruit is one of the things that has been getting a sort of a bad rap lately, in the sense of which is interesting because the bad rap it's getting is that it causes medications to work better. Well, why don't you take less medicine and eat more grapefruit? Like, to me, I don't know, is more drugs better for you or less drugs and more food that is good for you? Like, I always thought, like with cannabis, grapefruit will absolutely affect the absorption of cannabis. So like at one point we were doing THCA compounding, and the reason we did that was so that people could get the benefit without having to be so darn high. Well, that's great unless you eat a grapefruit and then all of a sudden you
keep it outside for a while.
Well, yeah, then that's gonna cause it to change on its own. But the point is, just eating the grapefruit alone can cause some people to experience a powerful effect. Well, again, to me, I was like, okay, that just seems to me like the grapefruit's good for you, right? Generally speaking, it's got pectin, it's got fiber, it's got vitamin C and a bunch of other vitamins. It's got water. I mean, there's really nothing bad about it. And it makes your drugs work better. So to me, it's a simple answer. Take less drugs, eat some grapefruit, and be fine and get the result that you want. Now, what do you have to do? You have to pay attention. You actually have to monitor yourself. You have to this is the thing that every practitioner that we've had on so far, and this is what I wanted to bring this into your conversation, is how important is it that people get to know themselves? Like, establish a baseline and say, well, how am I when I'm normal? Like, how do you know when you're off? Like, you ever check your pulse in the morning, or check your blood pressure multiple times a day, or check your blood sugar just to find out, how am I when I haven't eaten breakfast yet? How am I an hour after I eat? Normally, like, should be able to know that, right? And then you could know if something was off, instead of wait till you feel so horrible that of course something's off. I feel horrible, and then go and do something about it.
Again, that has a lot to do with how you take care. What's your preventative care? How are you taking care of yourself in general? Now, the other side to that is, once the doctor prescribes Lipitor, people normally follow the doctor's instructions.
There's that.
Okay, so of course,
don't think for yourself, people. Whatever you do, just do what the doctor says, and don't think for yourself. Don't learn anything, and by all rights and reason, don't experiment and find the best thing for you, because then you might find it. Just saying. Sorry. I do have strong opinions about that. How many deaths per year are a direct result of pharmaceutical over or under prescribing? Some, I don't know what the number is, but it's more than people died from CBD. It's more than people died from all cannabis use, period. And this is not a cannabis show. This is just a healthy living show. It's also more than people die from drinking too much water. Yeah, occasionally somebody dies from drinking too much water.
You drown yourself.
But it doesn't happen very often, and it's hard to do. And yet, virtually every day, probably every day, somebody dies from some mishap with a pharmaceutical. And that's not even bringing fentanyl and some of these highly, highly dangerous drugs that are out there today. I'm talking about doctor prescribed regular old medicine that you see in your nighttime commercial.
We have an opioid crisis.
Of course we do. Nobody's talking about it.
And it's quite unfortunate. I've grown to know that I truly believe in my heart that those that take cannabis on a regular basis are less susceptible to taking those medications, because they're not going to want to. You have pain, cannabis will take care of it.
Generally, yeah.
Okay, usually. And you have to talk to the right people as to what to do.
Right.
You can't.
Yeah, there's not just one answer for everybody anyways, smoke a joint, you'll be fine. Well, smoke a joint, you'll probably forget about it a little bit, but
natural medicine is not cookie cutter medicine.
No, it's not. And that was kind of really what I was getting at, was in every conversation with clients, patients, with people that just come for advice. I think one of the most important conversations to have is get to know yourself. I always tell people, start a journal, start tracking what you do, because you probably don't know. You probably don't know how much water you drink. You probably don't know how much food you eat. You probably don't know what you eat. You probably don't know when you eat it. You probably don't know how much sleep you get. And at least that gives you some kind of something to go by. And if you have a professional that starts asking you questions, and you had a journal to say, well, here's what I've done for the last 6 months, they'd go, oh my God, this is a gold mine of information that's going to help me understand what's wrong with you and how to help you, right?
Absolutely.
But who does that?
Not very many.
Not enough people.
Unless you really want to change. Losing weight is a big.
Well, that's probably the most quickly impactful reason for doing that
Mhm.
is, well, what are you doing?
What do we
You
today?
got to this thing. How'd you get there? What did you do? What are you not doing? And that'll tell you that story pretty quick for most people, I think.
Yeah.
You
And
know,
jotting
it's probably
down.
not a thyroid issue. I'm just saying. It might be, but it's probably not just that.
We're running into a lot of thyroid issues, believe it
Yeah.
or not. There's some physical appearances that we can immediately identify if a person has thyroid
Mhm.
issue. In clinic, we also treat thyroid conditions by balancing the hormones and without pig hormones. This is all
Interesting.
plant-based.
Nice.
Okay.
Well, and that's another thing, I mean, and again, mostly this conversation is to get to know Christine and her way she thinks about things. So we're kind of bouncing around a little bit to
We're bouncing
to
around
get-
in a nutshell of who I am.
yeah,
I was raised by a healer.
yeah,
Okay. This healer, which was my grandmother, did fire cupping.
yeah.
This is why I do it so well.
Nice.
The smoking the body, she did that too.
Yeah.
But a majority of my grandmother's healing came through hands because she had healing hands. I have
Yeah.
healing hands too. A lot of people tell me in clinic.
Mhm.
And what do I do about my health?
Yeah.
Well, I've been told I have optic nerve issues. But every time I go to the eye doctor, the optic nerve pressure is never found.
Yeah.
But yet they look at the pictures and they're like, wait a second, you're considered legally blind.
Yeah.
I do wear glasses. Sometimes I have difficulties with my eyesight, which is why I drink my lemon juice.
Yeah.
Right. Amongst other things that I do. But in general, I try to work out. I told you, I'm taking 10 classes.
Mhm.
I have 3.5 clinical shifts. How do I exercise? Well, I'm in lecture every 15 minutes. They give us a 10-minute break. I do jump squats.
I love it.
Then I get back in my class.
Yeah. That's
Okay.
actually a great practice. They say that, if they're doing this every 15 minutes, that's actually really good too, because generally after 20 minutes you overload anyway. So anything that runs over that, people are just going, oh, nothing's sticking anyways. And then to go and give yourself a jump start, get the blood flowing is super great for your brain and your body alike.
Yeah.
That's,
And because I deal with so many people, I hope I'm not absorbing the amount of energy, but I take my 3 salt baths a week or 2 salt baths a week.
and so by that, you just mean you're putting bath salts in your bath?
So basically what I do is I use really hot water, 2 cups of Epsom salt,
Okay.
1 cup of baking soda to up the pH in my system because I eat meat.
Yeah, I do too.
And that's high acid.
It's delicious.
Meat is very, very good for you. And
Yeah.
the other thing I'm incorporating into my diet is
I eat vegan
liver
meat.
pill.
I eat vegans. Cows are vegan. I'm just saying.
There you go, grass fed.
Yep.
Perfect. Perfect. It doesn't get better than that. But there's folks out there that say, well, if you eat too much meat, then it's going to swell up my joints. Well, not if you consuming your little bits of turmeric. Use turmeric on your cooking.
Well, you don't have to eat a whole gigantic fat steak. You can eat a reasonable portion.
Yeah, eat your 4 ounces, 5 ounces,
a reasonable portion. Yeah.
Exactly. Also, when I wake up in the morning, like I was telling you before, I do my tapping method, but it's not the tapping method that we're used to seeing. Although you can, this is very effective. Yeah.
I'm going to do it
that
too.
chi on the chest.
You'll see.
Literally this spot right here travels to all of your meridians.
Yeah. I'm going to knock my sternum.
Don't break the sternum.
No. I won't break it, but I'll get it to know who I am.
Move that chi around. That's going to help that circulation, that energy moving so you can breathe better. You're not having that blockage of chi, which potentially going to cause you to cough, going to cause you to gasp for air from time to time when you overexert yourself. So another thing, again, like every 15 minutes when I'm in lecture, I'll do that. Or when I go to the bathroom, I tell myself every time I go to the bathroom, I'm going to do 20 squats. Ass to grass.
That'll teach you to
ass to grass.
That'll teach you to go to the bathroom. You probably go to the bathroom less now, don't you?
No. I go when I have to go. But every time, and I used to do this at work.
Yeah.
And also, I'm not going to do push-ups in the bathroom.
Right. Now, squats are great though because you're using the biggest muscles you have, so they're getting the most done. If you're trying to do finger curls, you got to do a lot of them to get your whole body to do anything. But the squats you're using all your big muscles, and it's like, all right,
Yeah.
you get a lot more out of it, even just burning calories. You do your big stuff and you burn them faster.
Yeah, so I do that as far as exercise and things are concerned. I drink lots of teas, I drink lots of water. I really watch what I eat. I try to limit my carbohydrate intake, because if not, you can
I know, I could live off of bread.
Yeah.
I could live off of sourdough and croissants all day long.
Well, I don't do wheat.
Yeah,
at
well,
all
I do.
because wheat is GMO, and unfortunately,
But I don't do it much anymore. I mean, when I do, it's a special. We're out with family. It's in my normal. There's no bread in my house. I don't even have.
Well,
bread
I
in my
asked for
house.
gluten-free.
Yeah, I don't even have it. I'm just like, no.
And I don't do dairy either.
Oh, well,
if I do dairy, it's like a cheat kind of thing. And
grass-fed butter in your coffee, folks.
I don't do coffee that often because
I knew there was something wrong with you. I couldn't figure out what it was.
The reason why I don't do coffee, one, coffee's got to be organic,
Yeah.
and I've done some studies on coffee. Coffee literally is the most toxic liquid adults consume. It's
Well,
even
if it's
more
not good
toxic
coffee,
than soda.
if it's not
So-
good coffee, if
Yeah,
you
if
get
it's
good
not-
coffee, it's full of polyphenols, and
I'm
it's
talking
like,
about McDonald's coffee.
yeah, no, yeah, I'm talking about, I have good quality beans that are mold free and organically grown, and they're actually good for you. But most coffee's crap.
Yes.
And you're right.
I agree. Adequate sleep. You have to have adequate
Oh,
sleep.
absolutely.
Okay.
Oh, I'm the preacher of sleep. 7 hours plus for me every night, no matter what.
Yeah.
I will. I mean,
And another thing I strongly believe in is you have to do some form of stretching. You have to do some kind of weight training, and you have to do some form of cardio. Those three in combination, you'll feel amazing.
Especially as you get older, the weight training, and it doesn't have to be, pushing dumbbells or
No, you have
barbells.
tons of logs back
You got
there.
logs, you got pick up a rock or do some push-ups, whatever it is. That's all weight training.
Pick up the plants.
Yeah,
and
pick up
take-
anything. Yeah, exactly. Mostly it's just some kind of resistance, and as people get older, us over 50, most people start losing muscle mass, and they start losing bone density. They start to become frail. And if you don't do those things, that's a natural progression. But you have switches that go on in your genetic code that says, oh, you're getting old, go ahead and die. And you don't have to flip those switches on, and keeping yourself active that way by doing resistance training, by doing cardio, by doing the stretching. You keep those switches from getting flipped on, and your body's like, you're still healthy, keep going. And that's, I mean, in a nutshell, that's actually kind of what's happening. And so you can maintain your muscle mass, you can maintain your bone density. You don't have to turn into this frail old person if you just go ahead and make these changes. Well, listen, Christine, I wanted to introduce you to our audience. I am excited to have you be part of the healthy living community, and we have some big plans.
I can't wait.
And we're going to have all kinds of cool things that we're going to be working together, developing, teaching, healing, all of this stuff. I'm just really grateful to have you be part of our community. What do you have is there one thing, if you could only do one thing to maintain health, and everything else you didn't get to necessarily, but you got to have one thing for sure, what would you say that one thing would be?
Reduce your stress.
Reduce your stress. I think that's an important thing. By any
When
means
your
necessary.
emotions are, and I am living proof, when your emotions are here, you can't think.
Right.
You can't work. You can't even get along with your counterpart.
Right.
So by reducing the stress, grounding yourself, and centering yourself, you can deal with tons of stuff that are being thrown at you in a civil manner.
I agree. All right. Well, I think that's some good stuff, and I'm looking forward to some future episodes, and so much to talk about. This is we touched on probably 20 different topics that we could go and do an easy hour on any of them.
Oh yeah.
So,
I'll tell you one thing.
yes.
They teach us in school that empathy is a huge healing mechanism. Why? Because when you go to the doctor's office and you don't get empathy and you don't get understanding, they ask you 2 questions, give you a prescription, and out the door you go.
Yeah.
Well, how much healing took place in that office? When you come to our clinic, one of the things I focus on, I observe how stressed is this person, and the voice changes in my persona, how I approach that patient. This is their time. This is their time for you to love them, understand them, and get to what is truly bothering them. And that's usually done by just talking to them, reducing their stress at that particular point in time. And guess what? 70% of their healing gets done in that office at that point in time. And when they're done with that treatment, how do you feel? I feel amazing.
Well, and what you're getting into is an element of the placebo effect. And the placebo effect is the strongest medicine there is. And where that comes from is your body's ability to heal itself by accepting the things that you acknowledge as being okay. Like there's a beliefs that we have that can trigger your body to act a certain way. And you can take that all the way to the point of eating a sugar pill and believing that it's a pain reliever and feel the relief of pain. That sugar did not cause it. It was your body that did that by believing it. Well, that happens. That's an extreme. But there's also the opposite of that, the nocebo effect, that says, when I have no faith in you as a doctor, I'm going to reject most of what you do. And unless you do something pretty powerful, I'm not going to get much out of it. And so there's both ends of that spectrum that are happening to us all the time. And it varies from person to person, I'm just painting a broad picture. But when you can take the placebo effect and bring it all the way as far as it can go by instilling a trust in you as a practitioner, in the school, in whatnot, then the acceptance of whatever is happening, even if it's something they don't know or they're not familiar with or understand or believe is going to work, it opens the door for that to happen, and then it gives it a chance to work better.
Of course.
And I think that's many conversations, but I've put it to the test on a number of situations, and it's an absolute, there's no question about it. And that's why they do double-blind studies, because they don't even want the person administering the drug or the placebo to know which is the placebo, because there's these little tells, micro expressions that will pass from one to the next, and that person will know with that little twitch, and it won't work the same. And so I think you're right. And what is this school? Like, if somebody wants to go and find out, how do I find out about this in person?
This is my second acupuncture school.
Okay.
And the second one was definitely my charm. It's Southern California University Health Sciences in Whittier.
Okay.
We do have a clinic. It's mainly, it's been open for, I think, 75 years. It was a chiropractic school.
Okay.
And then they opened it up for acupuncturists. They had a master's program. Now they're bringing back the master's program. But they have the doctorate for that, and they have a master's program for PAs, physician assistants. So we have Ayurveda, 2 different types of certifications there as well.
Fantastic. Well, I'm looking forward to more of this.
I can't wait.
I appreciate you being here, and I'm looking forward to watching this place blossom, and
I can't wait to see this.
A lot of cool stuff going to be happening. All right, folks. Yeah, that was good. Let's see, where's my recording button?